Hi, my name is Alexis Lopez, and my presentation is on AIDS. Psalm 41:3. The Lord sustains them on their sickbed and restores them from their bed of illness. AIDS signs and symptoms. AIDS is a condition that is caused due to HIV, which is human immunodeficiency virus, marking the most serious stage of the HIV infection. HIV is a virus that destroys the cells of the immune system, which makes it difficult for your body to fight off diseases. Some signs and symptoms of HIV are fever, chills, mouth sores, and night sweats and rash. Signs and symptoms of AIDS is those caused by the HIV virus or other illnesses that attack the body due to the weakened immune system. The causative agent of AIDS is HIV. HIV is human immunodeficiency virus, which can eventually lead to AIDS. HIV infects important cells in the immune system that are critical in fighting off infections that typically do not harm a healthy person. Since the immune system is weak due to HIV, people who have AIDS can eventually die of an infection that is usually harmless to healthy people. When an individual is infected with HIV, they typically go undiagnosed due to the lack of symptoms or experiencing flu-like symptoms. An individual can develop AIDS but go undetectable for years, a period in which the disease can be spread through bodily fluids. HIV belongs to a group of viruses called retroviruses. These viruses use RNA rather than DNA to encode their genetic information. They then use an enzyme known as reverse transcriptase to turn RNA into DNA. Pathogenesis. The beginning stages of the HIV starts with flu-like symptoms, showing slight changes in the immune system. HIV has a very slow onset, usually taking years for the first symptoms to appear. The virus begins to infect the bloodstream and lymph nodes, slowly weakening the immune system of the infected individual. The late stages of HIV are known as AIDS, which is when the infection takes advantage of the body's weakened immune system. HIV targets the immune cells known as CD-positive T cells, causing the number of these cells to drop. The HIV attaches itself to the surface of these cells in an attempt to gain entry. When an individual reaches 200 cells per milliliter, the individual has now reached the stage of AIDS. This is the most severe stage as it is increasingly difficult for the body to fight off infections. There are two main chemokine receptors that are essential for HIV entry, CCR5 and CXCR4. CCR5 are present in cells such as T cells, monocytes, and macrophages, in which the virus can infect. CXCR4 infect T cells and T lymphocytes but do not infect macrophages. HIV belongs to a group of viruses known as retroviruses, so the RNA genome is reverse transcribed into DNA, which causes a lifelong infection. CCR5 and CXCR4 causes the viral cell and the host memory to fuse. There is partial uncoating of the viral capsid, leading to viral DNA production occurring near the nucleus of the host cell. Epidemiology. There are 3 routes that HIV can be transmitted: sexual contacts, transfer of blood or blood products, or from mother to child around the time of birth of the child. A majority of HIV cases are spread through the sexual contact in homosexual men. In the United States, 70% of the transmission of HIV occurs in homosexual men, while only 22% of the transmission of HIV occurs in heterosexual men. In 2024, there were 40.8 million individuals who are living with AIDS and 630,000 individuals who died from AIDS. 7% of the individuals in the United States infected with HIV were among people who inject drugs. Among individuals who are living with AIDS in the United States, around 40% are Black or African American, 29% are white, and 25% are Hispanic. Individuals who are African American have a higher rate of AIDS than any other race. Among individuals who are living with AIDS in the United States, most cases are dealt with individuals 55 years or older. There are some cases of AIDS seen in the age range between 45 to 54 years old. This disease is seen in older individuals since it has a slow onset and takes years for symptoms to occur or for the disease to be diagnosed. Treatment and prevention. A treatment for AIDS is antiretroviral therapy, which slows down the progression of AIDS. It is a mix of different medications to reduce the levels of HIV virus in the body. Taking multiple medications is more effective than just taking one, as some viruses can become immune to the medications. Some medications that are included in antiretroviral therapy are capsid inhibitors, protease inhibitors, nucleoside reverse transcriptase inhibitors, or pharmacokinetic enhancers. Measures that can be taken to prevent AIDS includes abstinence in relationships, the correct use of condoms while engaging in sexual intercourse, and educate individuals on the sharing of needles between drug users. AIDS is most commonly transmitted through sexual intercourse, especially between homosexual men. It spreads through bodily fluids, so it is important for individuals to take measures such as abstinence and the use of condoms to ensure the disease is not being transmitted. AIDS can also be spread through sharing needles amongst drug users, so it is important for individuals who partake in such activities to be educated on this. It is important in the Christian worldview to treat your brothers and sisters with love and support and ensure protection amongst all. These values can allow individuals to understand and care about the treatment and prevention of AIDS. Galatians 5:13. You, my brothers and sisters, were called to be free, but you do not use your freedom to indulge the flesh. Rather, serve one another humbly in love. Serving each other humbly in love allows individuals to support those living with AIDS and encourage further research for the treatment and prevention of AIDS.